Hello and welcome to my official presentation on radiation therapy. My name is Gilbert Hernandez. I am an undergraduate physics major at the University of Texas A&M Corpus Christi, and I'm going to be giving you a rundown on radiation therapy and its concepts, and I'm going to be doing that on a modern physics perspective. Now, radiation therapy is also known as radiotherapy, and it is most commonly used as a form of cancer treatment to kill normally or to control diseased cells, mostly cancer cells. And it does so by using the radiation to ionize the atoms and to prevent multiplication within those cancer cells or the diseased cells and to keep them from multiplying. And there are three main types of radiation therapy. First, there's X-ray based, then proton based, which are both extremely similar in regards to occurring outside of the human body. They both radiate photons and proton beams to help kill cancer cells. And then there's brachytherapy, which occurs inside the human body, which is normally used by ingestion or consumption sometimes, or maybe most commonly injection of seed or some other implant that can help attack the cancer cells from within. So for starters, the process is quite similar for both X-ray based and proton based radiation therapy, specifically because the patient is positioned and fixed in a certain spot so that a gantry will revolve 360 degrees around the patient so that the beam can take the shape and get a precise shape of whatever the specified region of the cancer cells might be located at, or the tumor. And this is extremely important because the positioning systems have to be quite accurate to limit the amount of error due to the movement of the patient. Now, specifically for X-rays, they can easily be more deadly, especially since they're more intense, but yet they have been proven to be more efficient in killing cancer cells more vigorously. But, of course, from that, vice versa, it is also proven that they're more capable of killing more healthy cells as well, which could be fatal to the patient who is receiving the X-rays and the emissions. And while the X-rays are emitted towards the tumor or the cancerous cells, they are specified within a target, but the thing about the X-rays is that whenever they go and they try and hit the region that they're targeted to hit, they keep penetrating after they've already gotten to the diseased cells that they're trying to kill off. So meaning that they keep going and harm even more tissue or cells, healthy cells, that they should not be touching or getting near at all. And from this process, they are still achieving the ionization that I mentioned before through their radiation. And specifically, they do this through a few different methods. The first one that is most dominant at high energies but is still always present no matter what the energy of the photons are, would be Compton scattering. So the X-ray photon enters the atom in the body of the patient's body, and that photon's energy is partially absorbed by a loosely bounded outer shell electron, and it results in the electron getting knocked out of orbit, which causes the ionization that this whole process is trying to achieve, and the electron then becomes a Compton electron, and the rest of the photon energy exits the atom as a scattered photon that has less energy that it primarily started off with, and it has also ended up changing its course. Another interaction that takes place is the photoelectric effect, and this takes place on an inner shell electron, and results in an ionized electron leaving the orbit with no scattered photon present. So meaning, in other words, a photon comes in and an electron comes out, but nothing else. There is no scattered photon, nor does it change its course. Instead, the energy of it is put into the electron and pushing it out, which is dangerous in most cases, especially because, any sort of scattering, especially with Compton scattering, any scattering of any particles at high energies that leave an atom is dangerous for any patient who's receiving this sort of radiation, and it is one of the main concerns in using this technique. So generally, proton-based radiation therapy is used to substitute X-ray-based radiation therapy in small cases to avoid error, and especially when operating in more sensitive spots of the human body or of a patient's body. And how it works is protons usually come from an ion source where hydrogen atoms are separated into protons and electrons, and the protons get injected into usually a cyclotron or synchrotron, and it's normally in hydrogen gas that's used, and hydrogen specifically because it only has one electron and one proton, which is quite simple to try and dissect its ion, and from there, from the cyclotron or the synchrotron, protons will get injected, or they will enter a selection stage where their energies are adjusted based off of whatever is necessary based off usually a physicist's calculations, and from there, the transport system conducts the protons out of the machine with the right energy and trajectory that's needed, and from there it goes to the patient room, and from there to the gantry. And it should be noted that when the protons are going through the process of accelerating to increase their energies, again through either a synchrotron or a cyclotron, that on average they tend to approach the speed of light, or 2/3 the speed of light, which is highly relativistic since it is way over 10% the speed of light. And so from here, we can see how tissue cells are made up of molecules, which are just generally a group of atoms bonded to each other. And we all know that for an atom, it has its nucleus, which is composed of protons and neutrons, and the electrons are orbiting it with up in the orbitals. And so when a proton beam emits protons, and those protons just enter the general vicinity of the atoms, they are able to drag out an electron out of the atom, which achieves the ionization that is needed in order to force the cells to not work properly anymore, which keeps them from multiplying. But what is special about the proton-based radiation therapy is that there's this thing called penetration distance, which is when the beam of protons go a certain distance to reach the tumor and then suddenly stop, which prevents it from damaging cells beyond the tumor or beyond the cancerous region, wherever the diseased cells might exist. And so this is a lot safer since it lowers the amount of error that could possibly take place if you were to go X-ray based radiation therapy, since in this case it stops penetrating past the designated point. And because of this process, if you do all the calculations right, you can cause a maximum amount of damage to the diseased cells and a minimum damage to the surrounding normal cells. And this is proven with the fact that whenever you emit these protons and they begin penetrating, they start to lose energy, but relatively slowly. And then all at once, towards the end of its destination, it will release all of its energy, which is a good thing in this case, so that it will do a minimum amount of damage to the surface of where it's first penetrating and the tissue that's in front of the affected areas or the diseased cell areas, and do its maximum damage, again, like we said, onto the affected areas and regions. And for the sake of staying consistent in keeping my approach straightforward with mostly particles and their abilities in radiation therapy, brachytherapy doesn't really use it, so just my overall discussion on brachytherapy is just how it's usually used by using needles or catheters to encapsulate or to place encapsulated radioactive material inside bodies near tumors. And aside from that, in order to conclude this presentation, I think it should be extremely noticed that modern physics does take a huge approach in radiation therapy, especially when dealing with particles, subatomic particles, photons, and especially whenever they're using kinetic energies and relative speeds that approach near the speed of light. Aside from that, thank you for listening and have a great day.